I'm joined now by Dr. Jessie Casabun here from Baystate Health to chat about some questions that people are having when it comes to breast cancer. And something that many people may not know is that men can be affected by breast cancer as well.
Yes, I mean, it's a lot less common, so it's not something that we often think about. For every 100 to 150 women who are diagnosed with breast cancer, we get one man who's also diagnosed. And we tend to see them do as well with the treatments, but the key thing that you have to remember for men is they often don't come in, you know, they're not thinking breast cancer when they feel something. And so, you know, part of it's just an awareness of your family history, if you've got a lot of breast cancer in the family, and then the other part is if you feel something that, you know, wasn't there before, that's the time you want to give us a call so we can look into it.
Bottom line, I feel like the message today is do not wait. Even if you don't feel something, you want to get in for those yearly screenings. At what age? I know it depends on family history, but when should women go in and get the mammogram?
Yeah, it's a really good question, and there's a lot of different societies with a lot of different recommendations, but I think most of us who are treating a lot of breast cancer, seeing breast cancer every single day can agree. Start at 40 for the average risk women and do it every single year, though very controversial. Yeah.
And there is promising news. It sounds like a lot of great progress has been made in treatment, especially when that cancer is caught early. Is there a lot of reason to be hopeful?
I think there's a lot of reason to be hopeful, and that's one of the main reasons I wanted to go into this field, is because we see most of the patients do really well, and I think it's exciting. You know, we're seeing them at their follow-up visits after treatment, and they're doing well, and we're all very happy. So yes, I think it's hopeful.
That is great to hear, Doctor. You still have some time out there. If you have any questions about breast cancer, maybe you're a man who didn't know that that was possible, call in today and talk to the experts here on hand. The number 413-846-0240. And I know you've had quite a few calls with some interesting questions today.
Yeah, lots of good calls, lots of good questions, even some stuff for us to look at, look into, you know, things on the future that we haven't even heard about. So thank you.
Yes, Doctor, thank you. And thanks to all the doctors from Baystate Health who are here today to answer the questions. Chris, back to you.